One of the main questions that we receive with people approaching us for problems with long COVID or vaccine-related illness is what testing they can do for themselves. And this is largely being driven because at the moment there's no single one test to diagnose long COVID, although it's fairly obvious for these people when they got sick and what caused them to be sick. But there's a lot of uncertainty about what is really going on in their body. So they're really searching for confirmation and testing to do that. So essentially we could divide testing up into two types. We can have testing looking at the effect of something, or we can have testing which looks at the cause of something. Or effectively we can describe this a different way in being the cause being the why and the effect being the what. So many people are turning up to our office with a lot of these tests of effect and what is happening. So they're getting a lot of tests which are effectively looking at what is happening in the body. So they're typically turning up with a lot of tests showing inflammation. So they'll typically show up with cytokine panels, which are effectively just showing that inflammation is present. Or they're getting a lot of the tests they get from their routine GP and doctor looking at full blood counts. They're typically seeing, a lot of these are coming back normal, but some of the things that are usually sticking out as abnormal is iron levels, B vitamin levels, the B12 levels. A lot of these things seem to jump around a lot when there's inflammatory processes happening in the body. So especially iron, that's intricately linked to inflammation. So when we see hugely high ferritin levels in the body on testing, when there's a lot of inflammation, that's actually quite a normal response from the body when there's an inflammatory episode happening or infection. The ferritin levels will typically go up. So it's not indicative that you're eating too much iron or supplementing too much iron. This is actually more to do with the inflammatory cycle. Other things that we're seeing are, thyroid levels coming back abnormal. Again, that's another thing that happens with inflammation. So inflammation can block and inhibit the conversion of our thyroid hormone from T4 to T3, the more active form. So people can get this test of showing there is low thyroid function. And typically, people will go to their GP in normal circumstances, aside from long COVID, if they're seen to have low thyroid function. If it's low enough to be hypothyroidism, that might warrant the diagnosis and therefore medication of thyroid replacement hormone. However, the thing is with a lot of these tests is that they're telling us what is happening, but they're not telling us why. So why is there inflammation? Why is the iron high or low? Why is the thyroid function low? Another test that a lot of people are getting are things looking at autoimmunity. So things like ANA or rheumatoid factor. This is becoming more relevant when people are approaching their doctor for long COVID or even vaccine-related illness. So again, what is causing the autoimmunity? So all these are really important to do as a first step. We need to know whether there is significant amounts of inflammation in the body going on, because that's quite damaging for our body, can lead to more issues. So we always want to do this first. We want to know what is happening. We want to know the diagnosis. We want to know, especially if there's autoimmunity happening, and especially like low thyroid function. Thyroid hormone is very important for the body. So we need to know the what first. And therefore, when people do this, they can get a medication if that is appropriate. We need to have things under control first. We need to have things stable to make sure this doesn't go any further. And this is typically the position people get to with the mainstream model of healthcare. So they'll go to their doctor, they get the diagnosis or the what, they get the medication, and then that's it. There's no further work there. You know, people are put on the medication to get things under control, and everything seems to be okay. However, in functional medicine, we always think this should be just the start of the process, because if we have controlled the inflammation, controlled the potential autoimmunity, got the adequate amount of thyroid hormone in place, we haven't actually addressed why this is happening. Because if we're just doing this, we're leaving all the causes left unchecked. So we always, in functional medicine, people approach us with the what, and then we need to figure out the why. And this is how people can really start to claim their health back. So in long COVID, this is the typical things that people are approaching us with. And our job is to figure out, you know, why is that happening beyond the infection or vaccine administration. So what testing may be useful for someone with long COVID, and we're trying to work out why they have developed the condition and why these things are happening. So a few tests that we're finding useful. Firstly, we're using a lot of organic acid tests, or the OAT test for short. So the organic acid test is really useful because it gives an overview of multiple different systems in the body, and we can really start to identify where the root causes are. So it will typically give us information on any sort of chronic underlying infections, fungus, yeast, candida, bacterial, mold. So it'll give us a lot of information on that and whether that's playing a role. It'll also show us information on toxins, or whether the body is trying to deal with a lot of toxins, looking at our antioxidants levels. And that's critically important to have when we're looking at COVID-19 or long COVID. If we haven't got the antioxidants to deal with additional inflammation, we typically get uncontrolled, inappropriate responses of inflammation happening. We also get information on mitochondrial function. So one of the hallmarks of long COVID and vaccine illness, of course, is a lot of fatigue. So we really want to start looking at what is happening at the energy producing centers in our body, aka our mitochondria. Other things we can get from this test is looking at neurotransmitters, and that can often help to explain any type of neuroinflammation happening within this condition, or anxiety. That helps to understand why that's happening. We also get information on nutritional status. What else? Amino acids. There's a lot of different sections to this test, but it gives us a nice overview of what's going on. Now, typically in long COVID, we're finding a lot of people firstly have a lot going on in the microbes. So a lot of them are showing up to have underlying fungal issues. So after we've looked at this, we can sort of start doing, more specific testing after this. So firstly, the OAT test is very specific, looking at fungus and mold. So that is actually quite enough. But that's one area we're seeing a lot with long COVID, is seeing high levels of fungal activity. And that really can contribute to perpetuating the inflammation and autoimmune processes happening. Another area is toxins, and especially in relation to mitochondria. So what we tend to be seeing is there seems to be a lot of toxin involvement in inhibiting mitochondrial function. So the toxins are blocking us from producing energy well. And this is likely to be preceding and pre-existing to the infection or vaccine administration, but the inflammation kicked off from those two things has the capacity to put additional strain and overwhelm our mitochondria even more, so that pre-existing imbalances start to manifest and start to show up. So these are two big areas that we start to see with long COVID sufferers. Another test that we're finding quite useful is from Immunsciences lab. And this is a lab from the States by Aristo Vojdani, who's quite an authority in the immune world. And they're particularly useful when it comes to looking at this autoimmune type picture. And a lot of the research that Dr. Vijjani is putting out is looking at the relationship between SARS-CoV-2 and other types of virus, especially Epstein Barr and types of herpes virus like HHV6. And what he's being able to show is that the SARS-CoV-2 infection can awaken dormant pathogens like the Epstein Barr and herpes virus, so that they start replicating and putting additional load on the body, and that actually within the long COVID condition, these awakened dormant pathogens may be actually playing a large role in that beyond the SARS-CoV-2. Within the testing, you can also get indications of early antigen of SARS-CoV-2 as well. So you can start to see if there's like an active infection going on. And that sort of can be quite indicative that maybe the body hasn't cleared remnant fragments of the virus. So you're still getting immune reactions, or the spike protein hasn't been cleared from the body. So again, the immune system is reacting to that and producing antibodies to that. So we're going to do a much deeper dive into this whole viral topic soon, so subscribe and stay tuned for that. However, hopefully this gives you an overview and gets your head around where you should be going with potential tests. So what we're seeing is that many people are, because they're getting limited answers from the mainstream, is they're trying to find or go online and get recommendations for what tests might be useful, and they're shopping willy-nilly for these things. So they're spending a lot of money on quite intricate cytokine panels and things like this. But this is only telling us there is inflammation happening. It's not telling us why. So the best thing that you can do is start working with someone who can direct you on more of these things. Your mainstream doctor, medical doctor, is going to cover this. He's going to cover the diagnostic stuff, the important stuff. However, working with someone who can help you to identify what's contributing to the inflammation and the mitochondrial dysfunction, that's going to help you to actually start getting your head around why it's happening and what things you need to do to help you to recover. If you can start removing the load on your body, removing the load on the mitochondria, you'll start to help your body get more capacity and start moving in the right direction. And although there may be costs involved with working with someone, it's going to take you far less time to get yourself moving in the right direction if you can find someone who can direct you on this. If you go on your own and start trying to buy lab tests online, interpret them, you go down a massive rabbit hole of trying to figure stuff out, and it takes a long time to do that. So finding someone can be one of the most effective things you can do to help your recovery.